morning and welcome to today's edition of your Good Governance and Public Accountability Program on the network service of Radio Nigeria, that is, Have Your Say. My name is Olayemi Daniel. Welcome on board. Thanks for joining us. Now, a healthy citizenry most times reflects in the socio-economic stability of a nation, hence the popular mantra, health is wealth. So, many nations throughout the globe invest huge sums in ensuring an effective health sector is inherent. More importantly is the recent global challenge brought about by the emergence of zoonotic diseases such as Ebola virus and the recent COVID-19 pandemic. But recent concerns in Nigeria are on the incessant strikes by medical personnel and the present ongoing strike by resident doctors, leaving many hospitals desolate and patients in dire straits. What is being done to address the situation to make Nigeria's health sector effective and efficient? To discuss this, we have with us the Honorable Minister of State for Health, Dr. Olorunnimbe Mamora. It's a pleasure to have you on the program.
Thank you very much for inviting me. Good morning.
Now, to be health minister in Nigeria is a tough task, no doubt. But many Nigerians also see you as a cool, calm, calculated person. How do you cope? How do you remain calm despite this challenge?
Well, I think the first thing is that being calm is in my nature. And the second thing is the grace of God. I mean, to cope with whatever situation that is before me. It's a COVAX facility, which is a global facility. And then, of course, we also expect vaccines from African Union through what we call AVAT. AVAT is African Vaccine Acquisition Task Team. So we are also expecting some vaccines from that agency. So essentially, we are expecting vaccines through multilateral facility, COVAX, and of course, AVAT represents on the African Union. And then you can have bilateral, that is direct negotiation, so to speak, government to government. We are not looking for vaccines from any private sector, at least not for now. So we have not vaccinated enough, I think we just about 2% or less than that. So we are still way down. But fortunately, more vaccines are coming in, and then we are starting the second phase of rollout by next week.
Just for clarification purposes, you say that Nigeria, we're not directly working with private organizations. Is that
for the supply of vaccines?
Okay, for the supply now.
Yes.
Okay.
Because we have to be very, very sure of the source of our vaccines, and because we also need to sign what is called the indemnity clause with the manufacturers.
Okay. Yeah. So signing this, what does it entail?
Well,
implication?
What it entails is that, all the vaccines, the COVID-19 vaccines being used all over the world now, they are produced under emergency use authorization. Because, these vaccines were produced under an emergency situation. Okay, yes. So the full hog of taking the process was not possible, because these vaccines were done within a year, which is not usual in terms of the processes. Usually, from the conception of the idea of the vaccine to roll out takes about 10 years. But we are now talking of something that we now do within a space of 1 year. So that's why each country will now, through its appropriate regulatory agency, ours is NAFDAC. We will now have to look at what has been supplied to us and then determine whether it's okay for us to use under emergency use authorization.
Okay. Yeah. All right. Now, some news reports say cases of vaccinated persons dying of COVID-19 recently abound. What's the situation as regards this?
Yes, we need to make it clear. Being vaccinated does not absolutely say you cannot be infected. But what we are saying and what we know from data, from evidence, from science, is that when you are vaccinated, then the chances are that if you get infected, you are not likely to go down with it. That is, particularly as to lead to death. You see, that's the general concept about vaccines. You know, even the usual ones, the measles vaccines that we give, the BCG for tuberculosis and all that, people still have, but what we expect is that if you have the disease, it will be mild. Okay. Yeah, but we do see, that's what we call breakthrough infection, particularly if it now leads to death, which happens, but it's very, very minimal.
Okay. Now, are vaccinated persons also vulnerable, especially in the face of the Delta variant, the threat of the Delta variant we now hear about? What's the situation as regards vaccinated persons?
Yes. You see, for every virus that becomes an epidemic or a pandemic, as we have with COVID-19 right now, the longer it stays in circulation, the greater the chances of undergoing mutation that we call variant. Now, when these variants come or or arise, then there are some of these variants that are not as deadly. So we just recognize them, that these are variants. They become variants of concern when these variants either now have the tendency for greater or easier transmissibility, that is, they get easily transmitted within the populace, and where they become deadlier. That's why we are talking of the Delta variant now, which is so deadly. What has been established globally is that one, is easily more transmissible. Two, the symptoms may even appear mild, but it's causing a lot of damage to the system. That's why we say it's deadly, because we have seen a number of cases that people have died with seemingly mild symptoms, and yet their oxygen, this oxygen in the system is getting so compromised that by the time you know something is happening, the oxygen level has become so low in the patient, and before you know it, they could just pass on. So that's what we're experiencing. And if you watch the news right now, particularly on CNN, you see that even in America right now, the Delta variant has been established to be affecting even the children that hitherto are thought to have greater immunity and to be able to withstand this Delta variant. But this is what we are saying now. That is why we continue to appeal to our people in terms of the need to comply with the non-pharmaceutical interventions and make themselves available when the vaccines are ready.
We're also hearing of an alpha variant. Is it similar to Delta variant? Are there differences?
Well, like I said, you see, the more the virus stays in the system, the more it changes its form, and that we call variants. But there are some of these variants that are not as, they are not as deadly as the Delta. You see, it's like when a deadlier strain becomes identified, it's like, let me just use the word, it now has a tendency to suppress, quote unquote, the other, lesser, yes, the lesser strains, so to speak.
So now let's also touch once again on vaccines. How can we ensure that in terms of logistics to reach rural areas is efficient and on ground? What's going on as this regards?
Well, again, you've been following the news now. You discover that we are receiving, within the next, some of the vaccines have already arrived. The Moderna vaccine, AstraZeneca, the Oxford BioNTech, AstraZeneca, the BioNTech vaccine, Pfizer BioNTech, then you have the J&J, Johnson & Johnson. Now, these are different vaccines for the same purpose. But for Johnson & Johnson, which we're receiving close to 30 million, about doses. And one of the reasons why this is vaccine we paid for, the federal government of Nigeria paid for, and we're receiving it through the African Union platform, that is this AVAT, which I mentioned. One of the reasons why we're going for that, because it's a single-dose vaccine. And it is to address the kind of situation you raised, that is people in hard-to-reach areas. So that you just give one dose. Because if you're giving 2 doses, it may be difficult to reach those areas. And again, people maybe in security, where we have security issues. So it may be difficult. So if we are lucky enough to be able to give just one vaccine, one shot, then we are okay. So that is even our preference. But we are not, since we don't manufacture, we can only receive what is available to us. Okay. So we are very, very conscious of that.
Is there any danger as regards some persons who might want to take, after taking the first dose for the Moderna one,
and they want to switch to
suddenly want to take the J&J?
Well, I know that there is an ongoing research as to determine what dangers that such people or people who attempt to do that might face. But for now, we do not subscribe to that. That is, we do not want a situation where people might want to, want to mix the vaccines. No. What we advise is that if you had taken AstraZeneca before and you are waiting for your second dose, just wait for AstraZeneca. Don't say because you've taken first dose of AstraZeneca, you now want to go to J&J.
Try and see if all will work.
No, we don't advise that, at least for now.
All right. Yeah. Now, is there any platform for feedback? Because sometimes we know when drugs come like this, there is the issue of adverse effects and so on. Have you been receiving feedbacks? And
oh yes. Of course, that is being monitored under NAFDAC. NAFDAC is the agency of government that tends to look out for these adverse effects. We call it that is adverse effects following immunization. So we have the platform for that, which is being monitored by NAFDAC, because we need to know what is happening. There are side effects that we expect from mild to moderate, even to severe. And we need to know this to also guide us in our vaccination process. So that is being monitored.
All right. Now, there's been this resurgence of cholera and the third wave of COVID-19, the Delta variant, Alpha variant. Is there a coincidence, or is it stretched and overwhelmed? Is it that the health system is overstretched as that regards?
Well, you see, let me just make it clear that cholera is a water-related disease. And when I say water, essentially it's a wash thing. What we call wash, water, sanitation, hygiene. Those are the three components that you will situate cholera. So if you have issues of environmental hygiene, maybe where people dump waste into the drainage system, or where you have even pipe-borne water, but you never know whether the pipe has ruptured somewhere, or the situation of open defecation, So these are the contexts within which you situate cholera as a disease, and particularly when you have outbreak, as we have right now in the country. And then, of course, it's water supply. It's potable water supply is very critical. So it's a public health issue, which is has to do with wash, like I said, and water supply.
Okay, so we can't just directly connect
No. Yeah. And then, of course, don't forget now with the rains and the flood carrying waste from, maybe from the upstream to the downstream, all over the place, that will further compound, Sure. But the main thing is to address the issue of environmental hygiene and water supply.
Okay, some Nigerians will still want to know, when it comes to taking the vaccination for COVID-19, does a person have to be tested first to see if he has, or you just go ahead and take it, whether it has been proven or verified or not?
Well, when you go to take your vaccine, naturally, because there is a kind of template where certain basic information about you will have to be recorded. Okay. Well, we want to know, for example, if you have what we call comorbidities, that is, existing health situations, okay, like high blood pressure, called hypertension, heart disease, liver disease, kidney disease, and what have you. Because these are things we need to know, because the reaction, what we call the adverse effect, may be a function of existing morbidities within the patient. And of course, it also, some of these situations do not absolutely preclude you from taking the vaccines. But we need to know, so that if, in case of any adverse reaction, we can easily link it, and they, of course, will help us better in terms of management of this adverse effect. So it's important for us to know. Okay. And of course, we want to know if, for example, if a candidate is pregnant. Okay. We want to know. We want just for us to have a kind of database that we can work on in case we have some adverse reactions.
Okay. So with this data and questions asked, or with a form filled, can the person be denied for the main time, or there is a way it can be managed?
Well, don't forget that the people who are giving this, most of them are like the medical workers, health nurses, and all that. There may be at times there may be reason, to stay action, as it were, and have an opinion of the doctor managing a particular case. That is, we may need to get a feedback from the doctor managing the case to say, look, this is what we have seen, and this is the history. We want to know, is it safe to apply or administer this vaccine or not? It's just plain safe.
Okay.
Emoluments and other associated conditions that will make them comfortable. It's rather sad that what we are witnessing right now, I can tell you because I'm in position to know, is exodus. Exodus of doctors in particular to, foreign land, which is not the best for us. So we all need to holistically look at the health sector and just, put it in a separate compartment in terms of addressing these issues. Now, the major issues we have right now, there are 4. First is the issue of what we call migration of doctors who hitherto were on what we call the Give Me's platform. Give Me's is just government integrated financial management information system, which is usually for non-regular staff. So the government is saying that those on that platform need to be migrated to IPs.
Okay, IPPIS.
Yes, IPPIS, which is, integrated personnel payroll information system, which is for the regular staff. So I'm saying that there are some doctors who are on that Give Me's platform, and so the payment of the salaries become irregular because it's for irregular.
Okay, Give Me's.
Yes. So, and in getting this sorted out, there's need for patience because it's not just for doctors alone. The health workers or other people who are not even health workers who are on this platform. And this is something coming from establishment and directly from the office of the head of the Civil Service of the Federation. So, and it's been established that because some people are irregularly employed, that is why they are on Give Me to start with. But if you're not migrating, then there are certain criteria that must be fulfilled, conditions that must be fulfilled to migrate. So, so they are saying that is from the Office of Head of Service, Civil Service, that these conditions ought to be met to regularize now. They are irregular employment. So that is why the delay. And to do this, there are processes. And government processes are not usually fast because of bureaucracy. So, but these issues have been addressed. That's one. The second issue has to do with medical residency training fund. The federal government, in its wisdom, decided that it will be paying for the training of resident doctors. Resident doctors are doctors undergoing postgraduate training or specialization course. So government on its own decided to be paying for this. For 2020, 2021, there were some shortfalls in that payment, which has, this has now been established. And the shortfall for 2020 and 2021, they have now been captured and is now reflected in the recently passed supplementary appropriation of the federal government. So it's been addressed. But you see, it cannot just be done in one fell swoop. It's been addressed. The third issue has to do with the circular that came to now remove house officers from the scheme of service. That is not to say that they won't be paid, no, but government, in its wisdom, is saying that is the establishment. You have National Council on Establishment saying that, look, because the doctors, they don't start in terms of scheme of service from house officer level. It's NYC, that is National Youth Service Corps, that they enter into service. So, but The NLD, NMA, they are not really happy with that. But again, there is a procedure and process for rectifying issues. And they have been told, write your submission to the National Council on the Establishment. When they meet, it will be considered. It's not Ministry of Health issue. It's National Council on Establishment.
Okay, so but you see, the doctors sometimes will say that there's been so much pressure and that these things have been the same excuses and the same matters coming up again and again and again.
There are so many bodies involved, so many agencies, so many institutions. So to really get these things unified and get, it's bound to take some time.
All right.
But it can be done better.
Okay. Yeah. All right, let's now go for a short break. We'll be right back. Stay with us. Thanks for staying with us. The program is Have Your Say, coming to you live on the network service of Radio Nigeria. Today, our guest is the Honorable Minister of State for Health, Dr. Olorunnimbe Mamora, and is speaking on the federal government's intervention on COVID-19 and the impact of the doctor strike, how to find a solution and a way forward. It's now time for Nigerians to be part of the conversation. Remember the phone line to call 0807 622 6771. Okay, yes, we have a caller. Good morning.
My name is Chief Fidel Onyeneke, and I'm calling from Owerri in Imo State.
Yes, Chief Fidel.
I want to appreciate the minister, but to quickly say that this is the worst time, very, very wrong for our resident doctors to embark on strike, considering the ravaging COVID-19 disease and even cholera in different parts of the country. The federal government should therefore do all within its powers to negotiate with the doctors and do what the federal government is supposed to do so that they will go back to work. Very, very important. Doctors on their part should appreciate the fact that they have to be patriotic and apply the humanitarian aspect of their profession by reconsidering this strike and go back to work to save lives while negotiations continue. At the same time, there is need for us to continue to mount pressure on Nigeria to appreciate the fact that to solve this issue of COVID-19, we must take it as our personal responsibility. People should not relax in following the COVID-19 guide rules and regulations, like wearing face masks in public places. Those who violate such rules must be appropriately sanctioned. Let us all be patriotic and join hands with the...
Hello? Okay. All right, the line remain open, 0807 622 6771. Hello?
Hello, good morning.
Yes, good morning. Your name, location, and go ahead.
Thank you very much. My name is Sadiq Umar. I'm calling from Jos.
Sadiq Umar.
Yes.
All right, go ahead.
Thank you very much. I want to commend the minister in the house. He has spoken well. But when we look at this pandemic, the issue of COVID-19, it is very, very unfortunate that at this level, the federal government is still talking about the vaccination and the protocols, whereby for a very long time, the federal government have to have some protocols that they have to be following. In terms of the vaccination, the amount of money that have been spending in the vaccination for a very long time, and the people are not accepting that the vaccination is something that is questionable. We urge the federal government to call on the people to administer to the people how important this vaccination it is, and also to collaborate with the local medical care so that we'll have our own local vaccination. But if we say that we continue spending money buying vaccination and they are not using it, it's something that is very, very unfortunate. And lastly, I want to talk on this issue of healthcare workers that are on strike. It is very, very unfortunate that in this kind of disease or in this rainy season that we have a high number of diseases and the health workers are on strike and the federal government have not negotiated with them. It's not only the agreement. These people need money. They need their agreement to be paid for. But the federal government will just make an agreement with them and they will not fulfill the agreement and they will continue with the strike. While people are dying in daily basis, people cannot access the health care because of lack of manpower. Thank you very much. God bless you.
All right, thank you, Sadiq. Hello? Hello? Hello, are you there?
Hello.
Yes, good morning.
Yes, good morning. It's I don't know. We're calling from Jos.
Yes,
good
ma'am.
morning to the Honorable Minister of State of Health. I must say that I'm really not happy with what is happening, in terms of the strike. We shouldn't penalize our doctors saying that they took an oath. You for your medical doctors too, the oath they took, you don't need to read it to the end. I can't see anywhere where any oath will say that the doctors themselves will not be alive. They have to be alive now. I will be afraid to even go to a doctor that is being old between 3 months to 19 months, unless what they are saying is not true. They have told us what it is. It's ridiculous. What is the bottleneck? That you owe a doctor from between 3 months and 19 months, and some of them have withdrawn. Their children have been withdrawn from school. They have to look for where they can put their children to be on school on credit. It shouldn't be so. Let's face it. Look at the mass accident yourself. Drain. My father has 2 medical doctors. They left for the US. What are you talking about? Well, it's misplaced priority. What is the bottleneck that it cannot be solved? In the hazard allowance, they have agreed to pay them. They refuse to increase it. Up to now, they pay salary, they didn't pay them. They just say they should go back and then negotiate. Say, what are they going to negotiate again?
All right, madam. We understand the situation. Let's see if we can take more calls, then we'll come back. All right. Yes, Honorable Minister, you've had contributions from a cross-section of Nigerians on the matter. Your response?
Right. Thank you very much. You see, well, in virtually all of them, the chief that called from somewhere in the east, I didn't catch the name.
Yeah, Fidel Oyeneke.
Oh, okay, Fidel. Thank you very much, Chief Fidel Maweri. Well, of course, he was just making an appeal for doctors to reconsider their action regarding the strike that is ongoing. Let me assure Chief Fidel that we are engaging the doctors, and our position has always been that there is need for them to go back to the round table for amicable resolution of the issues. And I can assure you that the issues are being addressed. The issues, they go beyond Ministry of Health. I just told you what the issues are, from IPs to issues at the office, from the establishment office that is headed by the office of the head of service, of the head of civil service of the federation, and of course the decision taken at the level of the council on establishment, which, if it has to be reversed, can only be reversed at that level. We have made that clear. Yeah. Then of course I think Sadiq from Jos, who is also advising that we should increase. That's my understanding of of his intervention, the need to increase the advocacy for our people to take the vaccines when they are available. Of course, every effort is being done in this direction, but it's also important to ask our people. We cannot overstate this. The need for them to comply with what we call the non-pharmaceutical interventions. The use of masks. What you see out there oftentimes is people are using chin mask or pocket mask as opposed to face mask. And we are the people seeing the figures on daily basis. People are dying from this disease. So we advocate, we plead with our people to comply with all these measures: washing of hands, use of sanitizer, keeping physical and social distance, avoiding crowd and all that. These are the things which we continue to advocate for our people, and it's important. And when the vaccines are available, people should present themselves to take the vaccination. Of course, the lady from Jos.
I don't know.
Okay. Of course, you're talking of so many things. Well, I did say from the outset that we're not saying some of the issues that the doctors are raising are not germane, they are not legitimate. They are. But you see, government processes, like I always said, tend to be slow. And no matter what, in a human system, you will have imperfections. But we have a duty as doctors to try as much as possible to be restrained, because what we are talking about is the lives of people. And when that life is lost, it cannot be brought back. So that's why we appeal. I did say the need for patience. The need for patience. The issues have been addressed. We have identified the issues, and they have been addressed and been addressed rigorously.
All right.
But there's a limit to how much we can fast track it, because it doesn't just concern one agency or one institution. It cuts across so many.
All right. Let's quickly take this call. Hello.
Good morning.
Yes, good morning,
My
sir.
name is Jude Ubad. I call from Imo State.
Yes, please go
I
ahead.
want to begin by commending the federal government for her proactiveness and effort in the fight against COVID-19 in the country. And I encourage her to do more, particularly now when you just suppose it on the fact that the present Delta variant of the disease that is spreading like wildfire and killing people more than the previous one is staring the country on her face now. And if care is not taken, we make nonsense of the efforts made so far in stemming the style of the disease in the country. I enjoin the federal government to encourage the National Orientation Agency to synergize with media houses like Radio Nigeria, traditional rulers, leaders of faith-based organizations, and others to intensify efforts in mounting a vigorous and aggressive enlightenment, sensitization, and awareness campaign on the non-pharmaceutical preventive measures, such as wearing of face masks, washing of hands in clean running water, or use of alcohol-based sanitizers, maintaining social distances, and others, together with embracing the nationwide vaccination exercise that is all going on in the country.
All right, thank you. Thank you, Chief Jude. Thank you so much. Yes, let's see if we can take one more and then messages.
Good morning, sir. Good morning, Honorable Minister.
Yes, he can hear you. Go ahead.
Yeah.
Good morning.
Yeah, I am. Good morning, Dr. Olorunnimbe. I am Comrade Martin Patrick Okoro. I'm calling from Atani in Anochukwu, Abia State, Nigeria. Sir, government should look inwards. Our local vaccine is what we need now, because if you see the population of Nigeria now and what we have imported now, it cannot go right. Like you rightly said, not up to 2% or 2%. Now, what do we do? Right now, as we are talking to everybody now, where is our Madagascar that they told us that we have not citizens? As we talk about immunity, there is need for government to make food available for Nigerians to eat very well and get that to boost their immunity. When you boost your immunity, no pneumonia sickness will ever touch, not talk about COVID-19. Honorable Minister Sam, as you rightly said, you have seen that cholera has ravaged so many states, up to 20 or 30 states in Nigeria. Now, you have seen that our environment is very, very dirty. Dirty is that in those days, we used to have sanitary inspectors. What is your ministry doing? So, because health technology, we know them before that there are people in charge of all this going around under health ministry, coming down to tell people, keep the environment clean. Is it not necessary for government to make sure that environmental sanitation comes out 2 times in a month? Workers, their own should be weekly, and even the traders weekly. This will help us save the environment, because, excuse me, you saw what they told us last
You need to
about
round off now. Hello? Hello? Okay. I think we already lost connection with him. But he was talking about health workers. Let's quickly take messages, then we'll come back to your Honorable Minister as we round off. From our social media platform, we have from Aliyu from Enugu. He says, I love your program. Thank you. Okay. Thank you to you too. Maduka Kingsley said, good morning to the guest and presenter. I would like to share my experience with what the minister said during the program about the exodus of doctors. I couldn't find an anesthesiologist to assist me in my surgery in the whole of Owerri. The 3 I used to call have left to Saudi. I believe he's talking about Saudi Arabia. Therefore, consultants, resident doctors are disappearing on a daily basis, and very few left overworked. Nigerians don't know what's going on. Okay, that's another situation, like you said earlier. Okay, back to you, Honorable Minister. Reactions.
Yes, once again, let me thank Chief Jude, I think from, Imo State? Well, essentially, it's just agreeing with what I said in terms of the need to increase advocacy to our people as to the need for them to make themselves available for the vaccination when the vaccines are available. If you've been following the news, international news, CNN and all that, you will see now that particularly with the Delta variant. Even, children are now falling victims. Children were thought, they were hitherto taught to at least have immunity as to withstand. You will now see children being ravaged. So that means that we need to really comply with these non-pharmaceutical interventions, for the good of everyone. Then I think Comrade Comrade Mazi, also, of course, advocating. Of course, he said, he talked about nutrition. You need to eat well. And when you say eat well, balanced diet, and of course, you need to take fruits and all that, which will boost your, I agree. We see there is a popular saying that you are what you eat. So if you eat well, then you stand a very good chance of having good health if you eat well. So it's important, and I agree with him. Of course, you also spoke about the issue of environment. I said that before, that cholera, all these other waterborne diseases, typhoid and all that. It's been established that, close to 90%, about 88% of diarrhea diseases, they arise from issues of poor water supply, issues of environment, poor environmental sanitation and hygiene. So these are things that are very basic. But let me also say this. Contrary to the belief out there, people tend to focus on the federal government. If you look at our constitution, what you find there, on the exclusive list, there are 68 items. Nowhere is health mentioned under those 68 items. If you go to the concurrent list, you have 30 items. Nowhere, again, is health mentioned under the concurrent list. Now, once you don't have a particular item specifically mentioned under exclusive or the concurrent, it means it is residual.
Okay.
And if it's residual, it means it's for the state. So health is essentially issue for the state. The federal government, through the Federal Minister of Health, is only setting up agencies to regulate. That's what the ministry does, and then formulate policies.
All right, let's quickly take this last call for today. Hello.
Hello. Good morning, Mr. Olorunnimbe Daniel.
Yes, good morning. Please make it very quick. We don't have time.
You are speaking with Nasser Hussein from Olmache Gusa, Zampara Teza.
All right, go ahead. You have 30 seconds.
Yes, sir. The Honorable Minister, you are welcome to this program. Happy.
Thank you.
Sir, you speak very well serious. And then, sir, this COVID-19 up to now, we don't even know which community it is. But this cholera they are talking about in the last, cholera, they are very, very loose people here. In my state, example, I said, people, they are lose their life in this coronavirus. We need to join hands together with state commissioners across the country so that to tackle this cholera. This cholera, people, they are very lose their life, very absolute here in this country in Nigeria. Thank you very much. We don't have much time. Nasiru.
All right. Thank you, Nasiru. Yes, Honorable Minister, last words as we close, just in less than 30 seconds.
Well, the first thing is to appeal to our doctors to please go back to work in the interest of Nigeria and Nigerians. The second thing is advocacy on the vaccination process. The second phase that is starting by Monday, that people should go out there and get vaccinated. The third thing is that people as individuals must take responsibility for their health. If you go out there and people are not wearing masks, make sure you wear your own mask and insist that whoever is next to you also wears his own face mask and not chin mask or pocket mask. Because people put their mask in their pocket and not on the face. So it's important. So that's my last take, if you like. Thank you very much.
Thank you very much once again, Honorable Minister, for making today's program a success.